matters. The topic for today is dose of jogging and long-term mortality. This recent study is another example that even modest exercise can have significant effects on longevity.
This is true. This is true. And as you know, Reed, in each of these sessions, we take a deep dive into recent research that'll bring to light objective scientific evidence of whatever the topic at hand is. And today we're going to look more closely at dose of jogging and the long-term mortality effects. So this study, as well as other recent research, is uncovering the dynamic nature of exercise on people, both physically and mentally. And runners, we know, tend to live longer. They have a lower risk of cardiovascular disease and cancer than do non-runners. So we do want to look at the actual evidence, Reed, because science
matters. Well, I didn't know that non-runners was a word, but I want to first mention that on our last broadcast, which was titled Microbiome Diversity Protects Against Pathogens by Nutrient Blocking, we had some questions come in, as we always appreciate and always have every episode. One of the questions, Dr. Gonshor, was, could you comment, please, on the clinical significance of nutrient blocking?
I would be very happy to do that. Well, remember, the discussion that came out of the paper had to do with what's called colonization protection. In other words, the protection that a whole group or colony of bacteria give the gut and the body in general. And it's been shown that increasing the number of species of bacteria in a large bacterial community tends to increase that community's protectiveness against what? Against pathogens. However, it is really crucial that certain key gut species be present. So compared with other species, these key species like E. coli, Escherichia coli among them, consume more of the same nutrients as the pathogens. That's the whole secret. That's why it happens. Individually, these bacteria do not have enough overlap to stop pathogen growth, but put them in communities, including these strains that have the highest overlap, that gives you the best protection. So alone, they don't do much. Put them together in a community, and suddenly, as I said last time, the magic begins to happen. So findings like those from the study that we highlighted a couple of weeks ago could pave the way for microbiome-based treatments for infectious diseases. How? Well, the nutrient blocking effect could be used to successfully validate predictions about which combinations of gut bacteria would be most protective against a given pathogen. Up until today, it's been throw it up against the wall, see what sticks. We need something better. We need to really know that we have a handle and a way, a window to knowing what would be the best constituents of a community for a particular problem. So as more and more is being revealed about the microbiome, the interest in microbiome-based treatments, it really is increasing. So a year ago, I don't know how many of you know, but the US FDA approved, after many years, the first fecal microbiota product called Rebiota. That is to prevent the recurrence of C. difficile, which is awful as a problem. And that infection leads, as you know, to anything from loss of limbs or loss of life. There's also an oral microbiota treatment now for C. difficile. It's called Vowst, and it was approved this past April. So things are moving quite quickly in that whole area. So with methods like the ones that were used in the study we enumerated, similar treatments could be refined to include microbes that compete with C. difficile. We may be able to create concoctions that will be very effective against C. difficile and many other bacterial infections, fungal infections, etc. So these other treatments could also be developed to target other pathogens. Also, advances in genomics can help us know what bacterial species a person has in their microbiome. And if you know that, then in the near future, with a little more research, we could potentially use that information, their genomic information, to figure out what species that patient needs to prevent or fight an infection. Think about it. That's very individualized treatment. So that is coming, and it's coming pretty quickly. But for now, the study is a reminder, amongst many things, that it's a recommendation for a diet high in fiber to promote gut health, and even more important, to minimize unnecessary antibiotic use. Physician beware, do not overuse antibiotics. Antibiotics, on top of everything else, are known to reduce microbiome diversity. Anybody in the field knows that. And you have a lot of patients who will have had antibiotics and they say, you screwed up my gut. Well, you've screwed up the diversity of that microbiome. And there's an association, a clear association, between taking antibiotics and the risk of infection by bacterial pathogens. So that's why physicians today are being taught, do not give prophylactic antibiotics unless there is a very, very good reason for it. And I can tell you as a clinician that I use a lot less antibiotics than I ever used before. As a young clinician, I used them a lot, no more.
Well, I think you're to be commended for that, Dr. Gonshor. And I know you're in the dental field, and that's where I see the prophylactic use being maybe overprescribed, possibly. Dentists, when they work on you, they don't want your teeth to get infected once they've opened things up, and you might be a little more susceptible. And so they do prescribe them a lot for prevention, which I think you're speaking against right now. And I like that. That's good. That's in alignment. So I want to thank everybody for submitting such questions. They help us all learn together. And I want to thank you for responding to that. Dr. Gonshor, could you please jump into today's study about dose of jogging and long-term mortality?
So dose of jogging and long-term mortality. And this is going to be a pretty short presentation, but it's important. So this was a study out of Copenhagen, a very, very big study that took quite a few years and was published very recently in the Journal of American College of Cardiology. And what they're saying is that there is a U-shaped association, we'll go over that in a minute, between all-cause mortality, right? People dying of any type of cause, and how that's related to the dose of jogging as calibrated by the pace, the quantity of it, the frequency, etc. So light and moderate joggers have lower mortality than sedentary non-joggers, which would make sense. The sedentary non-joggers, otherwise known as couch potatoes for the most part, whereas strenuous joggers have a mortality rate not statistically different from that of the sedentary group, which is fascinating. We know, and if I click on here, you see this?
Yes.
Okay. So we know that running is one of the most popular forms of exercise, and it may also be one of the healthiest. So that's been known for quite a while. And there have been numerous long-term studies involving thousands of participants that show that running benefits people physically and mentally. Runners tend to live longer and have lower risk for cardiovascular disease, cancer, etc., than non-runners. There's strong evidence that links even very short, occasional runs to significant health benefits. And that's particularly for longevity, the amount of time you live, and your mental well-being. So as this Dr. O'Keefe said, a 2-mile run a few times a week gets you pretty much the full benefit of running in terms of lowering mortality. Now, here's the background. Everybody see this? If not, let me know. People,
Always say it. Good job.
okay, so people who are physically active are known to have at least a 30% less risk of death than those who are inactive. That's quite substantial. However, the ideal dose of exercise for improving longevity has really been uncertain up until recently. So the objectives of this large study was to investigate the association between jogging and long-term all-cause mortality, focusing specifically on the effects of the pace of jogging, quantity, and the frequency of jogging. The methodology was they took close to 1,100 healthy joggers and about 4,000 healthy non-joggers, and they followed them prospectively since 2001. So you're looking at around 20 years, because I think this study came out several years ago. And then they did classic Cox regression analysis with age as the underlying time scale and the delayed entry. And what did they see? So if you're looking at the dose of jogging and you adjust for age and for sex, and 1 MET is the metabolic equivalent of a task. So if you're sitting around doing nothing, that is 1 MET. Of the 400 odd participants who were doing nothing, there were 128 of them who died during this period of the study. So that is the predicate. That is what you are going to be looking against. If you were doing light jogging or even moderate, which is 6 METs, so that's 6 times the level of the bottom line equivalent of little task, then you had a lot less deaths than you would have on an equivalent basis for those who were sedentary. But if you did strenuous jogging, interestingly enough, you didn't get less deaths per total population of that group. In fact, even less. There were 2 deaths in 40. So that if you were to multiply 40 by about 15 to get up to the 570 odd light joggers, you would be looking at 30 or 40 deaths. So they actually did not all that well. And it gets even worse, because if you adjust for age, sex, then smoking, alcohol intake, education, and diabetes, then those who were doing strenuous jogging really did even worse than they did on the upper grouping. And so what that's telling you is what we said earlier, that doing even more and more strenuous jogging is not necessarily better. In fact, it shows itself in these large groupings to be even worse than light jogging. There are some related studies. Here's a 15-year study on greater than 55,000 Americans, adults aged 18 right up to 100, who were running 5 to 10 minutes a day at a very slow pace. And it was associated with, as they quote, markedly reduced risks for all causes of death. Enough, they said, to extend life by several years. So that's not bad. And there's another study on exercise and depression. And this is an interesting one. These adults were followed very widely, were followed with a recommended 2.5 hours of moderate physical activity per week. And what they saw is that these people who did the 2.5 hours had a 25% less risk of depression compared to those who did no exercise. Again, very significant, to say the least. And even if they did half of the 2.5 hours of moderate physical activity, they still had close to 20% less risk of depression compared to the non-exercise group. So what did this group say that did this study? The takeaway was running even once or twice a week, as opposed to doing no exercise, shows the most benefit in terms of mental health. It's good to know. So what are the key takeaways? Joggers, as a group, live longer than sedentary non-joggers. light and moderate joggers have lower mortality rates than the sedentary non-joggers, whereas strenuous joggers, as I said earlier, expected to be even better, they have a mortality rate that's not significantly different from the sedentary group. Very fascinating. So if this hypothesis is confirmed by more studies, we may need to incorporate all of this into healthy physical activity guidelines for the general public. It's that important. So the benefits of running are shown to start within minutes. So the key message is, folks, any physical activity is much better than none. And with that, that's it for today's study.
Thank you.
There you go.
I appreciate that presentation, and it's obvious how hard you work at some of these presentations, Dr. Gonshor, and we appreciate it very much. And this study, by the way, was pretty easy one to read so far as the studies go. I enjoyed its plain text,
Yeah.
sort of common language instead of so much scientific stuff. So if you liked today's talk, please subscribe, like, and share. Very important if you share, especially if you enjoyed the episode. And we ask you to submit your questions, comments, and suggested topics to fdntraining.com/science matters. And if you want to copy the study, and I told you today's was really easy to read, it's a good read actually, is at fdntraining.com/studies. And they're all listed there, all the studies that we've done over time. And please join us again in 2 weeks on February 21st when we talk about gut microbial carbohydrate metabolism contributes to insulin resistance. And we want you to do that because
Say it, Reed.
science matters.
You got it.